Hi, everybody. I'm Christine Bruce, Senior Director for the Lab Medicine Program here at UHN, and welcome to the second edition of MedLab Chats. I'm really glad you can join us today. And as you know, if you joined us last time, we devised this sort of podcast to be able to shine a light on some of the unsung and possibly the sung heroes within our very special lab medicine industry. And we're smack dab in the middle of National MedLab Week, so happy MedLab Week, everybody. And it's a time right now, as I think everyone coming out of COVID, we feel like we need to amplify and celebrate lab professionals, and absolutely we should. But it's probably less known that MedLab Week came around in order to have lab professionals go out and educate the public on what it is that we do. And so we're going to do a little bit of that today. You're really lucky. You're all about to meet, if you haven't already met my guest today, you're about to meet one of the finest laboratorians, if not probably the finest one I know, probably about to be one of the finest ones that you know, and you'll learn today what she does. Today I want to show you just how far one person's career can touch across the globe, how many patients one person can truly impact, and I want to talk about why we bother with quality in lab medicine at all. And I want the idea of how do we know it's okay to start to resonate with people and have it be a question that we start to ask ourselves every day. So while we chat today, again, you can get involved just like last time. You can ask questions through the chat by scanning the Slido QR code, or you can go to slido.com and enter hashtag MedLabChats and enter your question there at any time over the session today. And again, I'll remind folks at the end if they want to add a little bit more. If not, I still have lots of questions, but I expect you're going to have some of your own. So as I said last time, and still true, I still have the best job going getting to lead the lab medicine program here at UHN. Since we chatted, we've been designated, the Toronto General has been designated the #1 hospital in Canada, and that's pretty exciting to get to work in, no pressure. This type of thing, this type of moniker of #1 doesn't happen overnight, and the lady off to my left here certainly had a hand in it. My guest today actually sat in on my interview when I came to get this role here at UHN, and I'm pretty sure that she sat there assessing all of my questions, wondering would I be okay. And on my first day when I got the job, she greeted me and said, "I hope you know you're going to be my last boss." And that was her veiled way of telling me I'm about to retire. And so with that in mind, we have 365-ish days left with Mary. So I'm really pleased to be joined today with the delightful Mary Fountas. Mary is the Manager of Quality and Safety Systems here at UHN and a card-carrying MLT. And Mary is concluding that chapter with UHN just around June, and she's going to take on another challenge being a manager of client integration for all of our partnerships, particularly the partnerships that I mentioned in our last episode. So here we are. There's a lot of stuff that I want you to know. She's slightly here against her will, but she never denies me an ask, and so I'm really delighted that you came and sat in the chair. I was right up to the last minute. I wasn't sure if you actually were going to, but there definitely is something about Mary that I want you to know. In fact, there's a lot of things about Mary that I want you to know. So Mary, welcome to our show.
Well, thank you very much, Ms. Bruce. And, hi, everyone, and happy MedLab Week, and congratulations to all our colleagues out in the lab professional world and all the folks that support those colleagues so that they can do their job. Very grateful for them.
Super grateful for everybody. So Mary, let's just pretend we're having one of our one-on-ones. We chat about this kind of stuff all the time. We're probably the two biggest quality nerdlingers out there. So let's get to know you a little bit better. Mary, for the uninitiated. I can't imagine that there are many uninitiated with you, but let's suppose there are. Tell us a little bit about you, how you've gotten to where you are, and what keeps you in this really cool space of lab medicine and quality in it.
Okay, so I sort of fell into this role because I'm a process-based person. I'm one of those folks that tries to figure out how to get out of the house faster every day. And when I went for my interview, I just talked about process and I got the gig. And then I got the information about what I actually needed to do, which was to bring 6 existing silos together under one umbrella of the lab medicine program, or whatever we called it at the time, to meet our obligations around our accreditor. So starting in 2000, in 2001, we started to roll that out. And then over time, I've been very lucky to work in this organization. People have asked me why I haven't left, and the answer is because there's always something new to do every year, every couple of years, big initiatives. So I've broadened my scope to some IT stuff, which we'll put to the side for now, but our patient safety quality program writ large at UHN always has something on the go and is really good about bringing us into it and actually using us to support those programs and as pilots. Excuse me, so that's the kind of stuff that I've been very lucky to do.
And has it been an easy road?
I love my job. I
Yeah.
love coming into work every day. I love moving something forward every day. There are harder days than others, but I love what I do. I
Okay.
love knowing that I'm trying to make it better.
Okay. So you rolled off the assembly line at the the then Michener Institute for Technology. Was it TMIT? TMIT. So now the Michener Institute for Education at UHN. And you said, I'm going to be a great beavered away on the bench for a little while, took on quality, and now here you are. What is it like to manage a quality management system like ours? It isn't the same as any other system that I've been in. It's the same in its nuts and bolts, but it's bigger. It's a bigger kind of thing to manage ours. What's that like? What do you think about while you're doing it? What keeps you up at night? Give us a sense of managing that kind of a system.
Well, it's easier now because we have some designated resources in the labs that are, pretty much full-time doing this work. So being able to work together as a team and not have folks, have their focus divided between operations and quality has been very helpful because of the size, as you say, of UHN itself, but also of our support of the partner sites. So what keeps me up at night is making sure that the folks that are the first line responsibility for quality have the right support to do the most important thing first, do the priority that comes into their email that day, be it a safety event or being an audit to make sure it's okay, or going and talking to people while they're investigating something. That's the big thing, just making sure that those folks are supported to do that.
And so, I mean, you mentioned that we have some resources that are now most recently assigned. I mean, how old would our quality management system be right now? So how long ago was OLA a thing?
2003.
2003.
But
so
we
it's
started in
been
2001.
Okay, the planning of what OLA,
and I'll
then
tell you
IQMH.
what day.
Okay, tell us what day.
September
Go ahead.
11th, 2001.
Oh dear, okay.
That was my first meeting.
Really?
Yes,
Oh,
in
wow.
the afternoon was my first meeting, and we all know that was a horrible day. But my first awesome director, as I sit here with my last awesome director, said, well, there's nothing we can do about that, and we need to move forward.
Wow.
So that's when we had our first meeting.
Okay.
Yes.
So, and interesting, and so I want to ask, because some of these questions are certainly not planned. I do want to ask, what does that feel like when you start to set the pace for what this new world of managing quality specifically is going to look like? Because as we look at our system now, and as we meet with some of our stakeholders and folks that are just entering the profession, the idea of quality is it's a thing in the academic outline, but really the living and breathing of it and the why is still not really known by learners, and we tend to have to embed that as we onboard folks, either as new employees or as students going through their preceptorships here. But did you think at the time when you were helping design what the future of lab medicine would look like from a quality perspective in Ontario, did you think it was going to be what it is today, or did you think it was something we were just doing because, it was an idea, let's try this, or sort of what was going on in that time? Because I was a receiver of it. I didn't get to be part of the
Right.
engineering.
I actually hoped it was better than what we have today. I think we still have a ways to go.
Oh.
I think we're still checking
talk
boxes.
about that.
I
Let's
think we're
talk
still
about that.
checking boxes, right?
Okay.
So, at the beginning it was around process, like what is process? And I remember sitting with a director who you and I love dearly and writing out a flow chart and them saying, do we really need to be that specific and that detailed? And my question to them was, do we want people to do it the same way every time?
Yeah.
So that kind of stuff, and just that communicating to people and making people see that formalizing direction, formalizing instruction, formalizing process in as much as you can for anything is really important, so that We're supporting the folks in what they're doing. They don't have to, make stuff up as they go along. And they're supported with the procedures and the processes and the escalation pathways that we have built in.
And so, how many years later? 20 and a bit?
Yeah.
22-ish?
Yeah.
And it's not where you wanted it or thought it would be. So what has gotten in the way of it getting there? You've got endless, well, I put that in quotes, you have endless resources. The world is our oyster, and yet we're not where we thought we would be. Evidenced by continuing safety events, continuing inefficiencies. Is that what you would use as your marker?
Yes, and also, evidenced by what we're looking for in terms of the accreditation requirements. They vacillate for me between being too specific and not specific enough. And so we need to, I like ISO 15189. It's great, but I think that we need to maybe take another pass at what do we add to it. There's lots of stuff that we do that isn't in there, and it's not that you have to necessarily have a piece of paper for everything. The overarching thing is, do you have a culture of safety? That is the number one thing, because a culture of safety will want to have procedures, will want to have standardized process and support for their staff.
And so, because I'm thinking about a conversation I recently had, and it was about following through on some accreditation requirements, and it was sort of intimated that, well, I need to have these sort of planned inspections so that I'm kept honest, right? And that's probably really reflective of many quality systems today, is that we do accreditation so that we make sure at a few points in the year that we can tick all the boxes, and yes, all the job descriptions are up to date, the training checklists are in the files, et cetera, et cetera. And I'm not going to say that we don't have those moments. I mean, at UHN, we certainly have, we didn't check the fire extinguishers or what have you. I remember, you'll probably remember the first time you and I went through an assessment together, and we were dinged on some fairly reasonable things that we should be on top of. And I was just shocked that a system like UHN's would still yield some of these little outliers. And it's a signal that you need more, or I took it anyway as a signal that you need more infrastructure to support and enable people to do all of those necessary checks, because I think the root cause was we didn't have capacity. We just, there was way too many balls in the air, and we chose the one that was probably in the moment the right one to preserve the health and safety of the patient or the employee at the end of the day. And we just didn't get to a box to check. So what would be the advice you'd give on how to change that mindset, even within the lab community, not so much the administrative community, that this isn't about box checking. We have to create that culture and resource it appropriately. It's whatever the thing is that's in the way that's making us think, I have to do this so that I get everything right on the big test. What's the advice that we take forward?
Well, I think the measure of if you're doing it right is the staff. Is how do they feel when they're working? Do they know how to escalate? Do they know what to do? Do they know where to go? Do they work together on stuff? Does somebody just decide, oh, this isn't working, so I'm just going to do this? That's really the measure. Like, passing accreditation is absolutely important, but again, they're not going to have every permutation and computation is not going to be there. It's about, if I'm on the midnight shift at 3 o'clock in the morning by myself, do I have what I need to do my job with what might come in the door?
And do we?
That's what we need to move
yes?
toward, right? That's what we need to move towards. And the culture in the labs is, the folks in the labs can be focused in many different ways in terms of throughput and in terms of not wanting to cause issues, not wanting to bring things up. So our safety huddles has been a very, very important addition to our culture. And the fact that, they are pretty successful, and we do individually ask everyone if they have any concerns today. That has to stick, right? You have to make that true. It has to be authentic.
Yeah. How would you grade us on doing that right now?
Oh, I think we're doing okay. When we see some of the safety events that come out, when we see some of the places where staff end up because maybe they're not as supported as we thought they were, that breaks my heart.
Yeah. Is that what's keeping you up at night?
Yeah.
Yeah. And so you're giving me 365 to find out how to fix it. What happens on day 366?
But it's iterative, right?
Yeah.
Because as you have new people in, new leadership in, you have to discuss these things. You have to make sure that folks know it is the expectation that you are working in a safe culture, that you are working with what you need, that you let people know that line 3 in that procedure has been wrong for a week. And it's not going to wait till the next regular review if somebody didn't catch it, because there are 5 documents that refer to that thing and we missed one, right?
Yeah. And that's interesting, because I wasn't planning on chatting about documents because you're talking about it. So yes, let's talk about something uber exciting like document control. But it makes me crazy. It totally makes me crazy because there's so many documents. You cannot stay ahead of the editing of them, and you should stay ahead of the editing of them and the keeping them up to date. And it's perhaps fresh right now because, as most people know, we're going through a changeover of our LIS system in the lab, and so the new LIS product needs to be reflected with the new workflows in all of our procedures. And that is a yeoman-size lift. And it's largely because we have so many independent documents that all need to be managed. And is this the way, and we just need to be comfortable that this is the way, or are we missing a better way to go about it? Because I think I've always had it. In all of the labs I've worked in, it's been this robust library of documents that are just electronically collecting dust in large part, because people get trained, they learn, and then they go do the doing, and infrequently pull that procedure off the shelf to review it outside of training, or has been my experience, unless it's one of those less frequently performed procedures. So is it right to have lots of little books? Is it better to have one giant book with it is a huge argument as to how to build documents that support people in doing their job every day, or is it just a swath of flowcharts with if this, then that people can reference while they're actually sitting at their bench doing their work?
Well, I think it depends. I can tell you that our transfusion folks have their procedures up all the time. You can, that's for sure. So I would like to see, holograms, minority report. Like, that's what I want to see. I am doing bench X, and then the procedures and the checklists and everything for bench X comes out, and it like reads it to you, and then you can actually check off the checklist and all that kind of stuff. It's hard. It's hard when it's on paper. It's hard when it's electronic. We're better in terms of the actual document accessibility that we have with all the extra, PCs that we have now. When I trained here in one of the labs, I went through my entire training, and the second last day, the charge tech dropped a binder on my desk and said, "Oh, you might want to read these. They're the procedures." So I'd been completely trained and then needed to read the procedures for some reason. So that's not the way to do it.
Right.
So I don't know what's best, but I do know that part of the safety culture is not to memorize things, not to think you know. And it's not about professionalism. It's not about scientific acumen. It's about, we could have changed it on you 3 hours ago and you haven't got to your action item yet. So just make sure that it's a 1 in 4 dilution as opposed to a 1 in 10.
No, oh, geez. Fair enough. It's like, so glad that you went in that direction. I'm like, I hope she says this. Okay, so we'll pivot a minute because I'm confident everyone's on the edge of their seat wanting to know more about quality systems. But I want to talk about the cool things that outside of our cool quality management system that you have done with UHN. So talk about where you have gone around the globe for UHN in the pursuit of quality and supporting lab programs.
Okay. Well, our friends up north, lots of friends up north. And Newfoundland, that was awesome, and Kuwait, that was 8 or 9 trips back and forth to Kuwait over the span of 3 years when we were helping them with their cancer center. And those folks talk about starting with the bare minimum. They were using, some good stuff, but WHO stuff. That's all they had to work with was the slide decks from the WHO.
Wow.
Yeah.
And so what was your role in that? So years of travel back and forth, coming home, beavering away, going back, implementing, I'm assuming. What did you do? What was your contribution to that?
So they were moving forward with a version of the sort of the 60s AIM statement version of the Accreditation Canada hospital-wide accreditation program. So we needed to get them to where they needed to be. They took some of that and then they took something else, like a bunch of stuff. So the Kuwaiti government basically had a committee that put together this accreditation requirement, and some of it was based on accreditation, sort of the AIM statement version. So we needed to have them understand the intent, and then see what they had, and then get them realize the gap, so that they were successful, which they were.
And so what was the toughest part about that for you?
The intent is always difficult, and there was just folks that have come from all over the world. There's some really, really, really good techs. The power gradient was significant between the bench tech and the team lead manager, whatever they were called, and the lab director. So you had to talk to the right person to get the thing done. And just they also needed to gel as a team to be able to move forward to meet the requirements and to make their lab better and proceed.
And so then when you're on your last flight home from Kuwait, did you just go into Kuwait? That was the only...
Oh, well, we got to go to like Dubai and Doha and fun places like that
fun
too.
Places. So on your way home from whatever fun place you were coming home to or from for the last time, so what were you reflecting on? What were you thinking about?
How far they'd come,
or what needed to still happen?
Right, how far they'd come. I knew I had gotten through when I went into the hematology manager's office, and there was a sign that said, "Mary says, if you don't have evidence, it didn't happen."
That's how you know.
That's how we know.
Well, that's a pretty awesome legacy to have. What would be cool is to find out, is the sticker still there?
Yes, it would be cool.
Yeah, neat. And so reflecting on that was a sort of a highlight that you felt good about that. Anything that you wish you still could have also gotten done or influenced, perhaps not even within that particular project, but something that you would have liked to have participated in?
Not really. I mean, I think I've been very fortunate. I was on and a chair of the YOLA advisory, whatever it was called, YOLA advisory panel. So that was a wonderful experience. I was a team leader on assessment teams. I was on the 15189 committee with the College of American Pathologists. I got to go to New Orleans and give a talk at CLMA. So I mean, my career has been pretty, I've been very fortunate.
Nifty.
I have volunteeritis, right? I have hand in the air, which is why I'm here.
That's why you're here. That's why never say no. And so why was Newfoundland so neat?
Eastern Health was they were just trying to move forward, and they had some really good leadership, and they had an awesome accreditation lead who came from the airline industry.
Oh.
And she was great, and so working with her was great, and she was great because she kept doing this for the lab check-in with me. So this is what I would do in the industry that I come from is, will this fly in labs, stuff like that. So we worked together very well, and just the team there, having to fly in from Labrador for team meetings, like that's work. Like it takes a lot for those folks. So they were all super, super engaged people.
Nice. Work to do the work.
That's right.
Yeah,
that's right.
Very, very cool. So across the globe, so this is one little MLT coming out of school and is going to implement stuff in Kuwait, stuff in Newfoundland, stuff in the north, stuff right here. Lots of cool stuff happening. So let's talk about your stuff at Michener. So when I became an MLT in '97, so it's been a while. At no point did I meet Mary until 2019 in person. So I think it was through a team meeting we were having here, and I was at Mount Sinai, and I was coming over for a shared team meeting. And we were sitting around the table, and you said, I used to mark your assignments at Michener. I'm like, actually, no, I didn't know. And so and when you're on an online course, you're doing what you need to do, and you're not really paying much attention to who's giving you your grades. But apparently, Mary thought that I was reasonable and gave me a quality manager certification, or greenlit the certification from the Michener. So how did you get involved in that? Because that's a pretty darn big course that a lot of people tilt into to qualify themselves and say, yep, I can do quality because I took the Michener course. And so you're a pretty big hand in that. So did you develop it? Did you co-develop it? Or did you simply instruct it?
So part of my journey also has been some fantastic mentors. Maury McDonald was the one who got me in that. So I was in the first cohort of that class.
and she and Darlene Hendrickson and two other folks whose name I can't remember because I'm 63, developed that course, and I was in the first cohort, and then years later, Maureen was running it on her own because folks had moved on and needed some help with marking, so I got paid to mark. And then I started, then she folded me in to help her with some of the courses. And the other thing that I did with you was the online bulletin board chats, the
yes.
drop-in chats, and you always had the right answers and always asked a lot of questions. I remember that. Yeah. So I don't need to stroke you because you're already my boss, but yeah, it's yeah, you were good. So I did that for like 10 years all told, and then brought in Judy Sherman-Jones, who is also awesome, and she was in the first cohort with me.
Oh, great.
She's actually still doing that. I dropped out a few years ago.
You just dropped out. You got too busy.
Yeah,
Too busy with
it's
stuff.
time. It's time to. It's just like the quality manager role. It's just time to hand off to somebody else.
So when you were doing that marking and then instructing, so was it just for folks from Ontario, or were you seeing a broader outreach of lab folks coming on to take that program?
Yeah, definitely. Well, when we did it, when we went through it, there were folks from Kenora Rainy River and other fun places in Ontario, and we had to bookend actually in-person weekends because we did a bunch of team stuff, culture stuff, and we did that together, which was really cool. When it went online, I had an ECG lab person from Alberta take the course because they wanted to understand what this, quality system thing was. So yeah, all over the place.
So you're influencing the West too.
Oh, sure. Maureen and the gang's work is, Judy and I tweaked it a couple of times, but the basic stuff is there, right? It's the how do you know it's okay.
And so how do you know it's
How
okay?
do you know
So that'll
it's
take us
okay?
into our, so we're getting close to, I'm just watching the clock, making sure I don't ramble on too long because Mary and I can talk for a long, long time. But just before we talk about how do we know it's okay, just reminding folks that if we've sparked a question, then please do put it into slido.com at #MedLabChats, and then we'll roll them up here in a bit and answer any of the pressing wonderments that you have out there in the interweb. So Mary, you've seen how we got to how we evaluate ourselves. You've done the actual work that's being evaluated. You've taught the people doing the evaluating. You've seen how it's done across the globe, and you've influenced how it's done across the globe. How do we continue to know? First of all, is it okay? And how will we continue to know or evaluate if it's okay?
Yeah, so is it okay? So what is okay is the first thing. So what is it that, when this happens, what do we want you to do? What is the direction? What is the instruction? What is the support for the folks? And then are we actually doing what we said? And that's the how do we know it's okay, right? The safety events is the horse is already out of the barn, the monitoring, going in and talking to folks, watching them, direct observation, auditing, all that good stuff. It's iterative again. So you just have to keep looking and fixing as you go. And initially, when you do something new, the other thing that my first director taught me was, ready, fire, aim is not the way to go. Think, act is the way to go.
And so if we went out to the quality masses and said, you know what, you've literally got a minute to spend on anything, what would you tell them to do that would top 3 things that you would ask them to do or suggest they do to influence quality in their own programs? What would you think?
Well, I think making risk management, making risk assessment bigger, making needs assessment bigger in your quality program is really important. And just taking the time to try and flesh out all the stuff that is going to influence within the lab and outside of the lab, what that new thing or gizmo or method is going to be. That's really important, and engaging the staff to do that in as much as possible, and not being punitive.
And that's tough, right?
It is, because nobody likes to be told that something bad happened on their watch, but nobody comes into work to make a mistake.
The system just allows it.
That's right.
Yeah. And so I'm peeling you out of this job and putting you into another fun, cool job. Is there something that you kind of wish you'd have gotten to?
No.
Nope, you did.
No,
I really
mean,
thought you'd have an answer for that.
No, I have no regrets, right?
Yeah.
You know?
Well, I just need to, have you regretted anything? But I just wondered if you feel like
No
maybe
path
there's a
not
bow not
taken.
tied.
No path not taken. I mean, you know, in this organization, I've worked with other folks. That's another great thing about being in a sizable organization such as this, though it's true anywhere, is I've been able to work with other folks that are sort of like-minded or have some background in this type of thinking, the process thinking, and have tried to, you know, make this organization have a different approach to some things. Some of that has been successful, some of that hasn't. Some of it, you know, you say something a couple of times and then 3 years later you hear somebody say that, well, why don't we try this? And you go, yeah, great idea.
Yeah, great idea. Okay, that's awesome. Whenever we chat and have our social time, you usually suggest movies that I have zero interest in because they're usually festooned with subtitles. And so I was thinking of how I would wind down to the question period. And so I've always envisioned this podcast to be a lot like the Actors Studio, but the spoof Actors Studio that Will Ferrell does with the James Lipton spoof with like the giant deck of blue cards. And the Actors Studio is always concluded with an edition or rendition of Bernard Pivot's questions. And so whether we know or not, and perhaps Mary doesn't know, but Bernard Pivot is a French journalist who uses these questions to, and I quote, add nuance to an interview and depth to their subject matter. So you're ready to have some depth added to you?
Okay.
Okay, so there's 10 good questions, and then we're going to go to Slido. So question number 1, Mary, what is your favorite word?
Wow. It's not wow. Interesting. I don't know.
Is there a word you use a lot?
Ostensibly.
I totally expected you to say that because I had to look it up the first time you said it. Got that one right. What is your least favorite word?
Can't.
Oh, nice. And what motivates or inspires you?
Just making it better. Just people, you know, just trying to find that spark in people and helping them move forward. Like, you know, I'm a lead from behind kind of person. Yeah.
And conversely then, what squelches that motivation?
Well, you know, it's not that people do this intentionally, right? People come to work with their life, and stuff might not be going well in their life. And I've had times where my life was not going well, and I had to come in and you know, do my job and perform. And when you catch somebody in that kind of mindset in a negative situation like a safety event, that's really hard. That's really hard.
All right. And what is your favorite food?
Probably a Greek dessert called galaktobouriko, which is
What is that?
basically a custard made with semolina with phyllo pastry and the obligatory, you know, sugar honey water.
Okay. When was the last time you had that?
In Greece, March the 18th.
Down to the minute. Okay, great. Mary, what sound or noise do you love?
Laughter.
Laughter. And what sound or noise do you hate?
I don't think I hate any noise. I mean, life
Is there a
life
dislike? Is there a
full
noise
of,
that...
full of? I don't like loud noises. I'm not a loud noise. I don't know if I have a little bit of something in me, but I don't like loud noises.
Got it. Okay. What profession other than your own would you like to attempt?
Wow.
You're getting depth.
Yeah.
That's what's happening here.
Yeah. Would I like to attempt, or
Yeah.
might I have attempted? None really. I mean, I loved being a lab tech. I love doing what I'm doing now. I can tell you the one I wouldn't do, because that'll be
That's
your
the
next
next question. What would you not want to do?
I'm not really great at actually teaching people. Yeah.
Right after the whole Michener conversation.
Yeah,
not great at teaching?
no,
Okay.
like it's just
Tell me more.
It takes work. It takes work. It takes a lot out of me. Yeah.
It's because you're an introvert?
Not really. I'm like most people that will laugh that know me, I'm just so empathetic about what the other person is going through and how I'm coming across. And I know that that's not my normal speed, but when I'm the teacher, that's an issue for me.
Noted. All right, so do your best with this question.
Okay.
It's the last one, and then we'll go to Slido. If heaven exists, what would you like to hear God say when you arrive at the pearly gates?
Good job. At life.
At life? Excellent. Well, with that, you're officially deep. You have depth and we have nuance in our session. So we have a couple of good questions. So thank you so much, Mary, for that. So we'll see what the folks out in the ether have to say. So question 1 comes from Ankron, my pal across the street. Lab management has traditionally been about balancing cost, quality, safety, and customer satisfaction. In this economy of constant budget cuts and lean management, how do we ensure quality is not compromised? Aside from common performance indicators, what other useful tools could be employed? That's a big question. I'm glad I left a bit of time.
Tools?
Well, let's start with the cost, right? How do we do it without how do we manage our dollars without compromising quality? And we see that and have that arm wrestle every day.
I would ask you that question. That's the ops question as far as I'm concerned, right?
Just don't do it.
It's the knock-on effect of not doing that piece correctly where I have to come in, right? Because that's when bad things happen.
Yeah.
Right? So if it's the, what do people actually need? What can we actually provide? And those, authentic and difficult conversations about that with the providers, with the site.
And that's probably the case. It's that authentic conversation about the how do we know it's okay? And if it's not okay, what amount of risk are we willing to weather as an organization, as a professional, et cetera, et cetera. But that is one of those questions that to the less involved in quality systems, when you say, quality is expensive. I think I remember being at CLMA and having one of those talks around the cost of quality being so exorbitant, and is this really a worthwhile spend of healthcare dollars? And I think we continue to argue that yes, it's the right thing to do. I think it needs to be postured differently, and the story needs to be told in a different context, not this is broken, we need to spend a lot of money to fix it, and then someone won't get hurt. It's starting at the other end of that conversation, that there's the potential for someone to be hurt, and therefore we need to invest in safeguarding the process versus have it not be such a cause and effect.
Right, and it's prospective. I mean, relationship management, especially with the organization, with the providers, with the programs, is so important, because we can find ourselves doing a whole bunch of stuff that nobody even knows that we're doing and nobody's using. And that's the problem, is we have to know what we really need as a unit. The system is all of us, it's not just the lab.
Yeah, and that's the heartbreaker, that there's a lot of things we've built to safeguard that no one is using.
That's right.
And you can walk around the lab anywhere and find lots of boxes that are being ticked and no one knows why they're ticking them, and no one knows what to do with the information if that box turns red.
Right.
So that's a good lead on to the second part of that question. So aside from common performance indicators, like that red box, what other types of things can we or should we be using to evaluate quality? Or is it really just establishing good KPIs?
Well, I think the quality, the safety huddles, and the fact that, we look at environment, we look at inventory, we look at resources, we look at our equipment, you're looking at everything all together, and it's not siloed, is really important as well. That just that constant vigilance around what is the system, what can we provide safely and consistently and correctly.
Okay, so the second and probably the last question is from an anonymous viewer. So how do labs maintain quality of work when they do lots of tests at the same time? Also, how can you provide timely results other than ignoring the time frame or lost samples without impacting patients? So not entirely sure what the exact question is, but I think that the gist is, so how do we do it when there's just such a volume pressure in this, our current state, and I wonder, pre-COVID, were we not busy? I think we were busy pre-COVID, and we're feeling like this is a post-COVID outcome, but I think labs have always been pretty darn busy, and people have been needing care and evaluation. And so perhaps the busyness is just amplified because of resourcing challenges and the like. But so So what do we focus on then? We don't have enough people. We're missing something. People are tired, et cetera, et cetera. It's a pretty low ball, easy question. What do we do to maintain quality?
I don't really understand the question, but
Well,
I would say one of the things is that you have to validate, you have to verify your process. You have to know that what you can consistently provide.
Yeah, yeah. And I think the sharing part that you mentioned earlier today is that if you are in a system where something isn't okay, you need to be able to be liberated to raise that up and highlight it to individuals that can influence some change, whether it's a communication of we can't safely provide this service and therefore we need to pivot and go in a different direction, or to provide whatever the necessary resources, right, to get the job done.
Right.
Yeah, no, that's fair. So I don't think, what advice do you have for someone early in their career in MedLabs? Just a general advice. I've decided to become a lab tech or a lab assistant or a PA or a clerk, anyone within the lab industry. What advice would you give them as they enter a career and you wind down a career?
Well, it depends on what they want to do with their career.
Oh,
but
it's
if
always
they
a depends.
Well, it does, right? If it's somebody, like I went to school with lots of folks that worked the bench for 35, 40 years and then retired, and they were happy and it fit their life and that's what they wanted. If you want to look for opportunities, you have to sometimes, put your hand in the air when you're maybe not comfortable to do that. You need to let people know that you're interested and you need to be able to offer something. So I did a couple of certificates. I've done some other stuff, that I had to pay for, that I had to fit into my life so that I was attractive for a particular role or for a particular project.
Mm-hmm. So is there anything that we chatted about today that you would want to say more about, or something that you wish I'd asked you to talk about that I didn't?
Nope. I think
No,
we're good.
I hit all the high notes.
No, it's all about culture. It's about we are in this together, and power gradient is something that sometimes we do have to overcome, and it's difficult, but and it has to be respected as well. I'm not saying you should break it down. I'm not a socialist, but but it's the thing. It's the I have to be okay coming to you and telling you everything, and you know that sometimes you don't like what I said, but it has to be okay that I can do that.
And you feel it's okay, right?
Absolutely.
We've definitely developed that culture, but it's okay.
Yes, that's why I'm still here 3 years after I meant to not be here.
So here we have it. Okay. Okay, so no more Slido questions. I've certainly got all I needed out of you. I really hope that out in the interweb, people have garnered an appreciation for what one lab tech can do. And I came about saying, I think we need to talk to Mary after a site visit. I forget which hospital I was in. It doesn't matter. I'm confident it reflects in lots of hospitals, where I asked somebody about, well, why do you do it that way? Which is classic for quality folks to ask that question. Why do you do it that way and not this way? I said, well, because I'm just a lab tech, right? And that just breaks my heart to have someone believe that they are just at anything. We're all very good at what we do, and we've all got an absolute right place. But you can also do things like what Mary does. And I wanted for people to have an appreciation for what one person can do in their career and how far they can touch, how far they can go, how many patients they can truly affect from their pulpit of being just a lab tech. So Mary, thank you for serving our system, serving it near and far. Thank you for giving us all just a new and higher purpose, and thank you so much for just being my wingman for this short amount of time that you didn't want to spend, but that I'm going to drag on for another year. And when we get to the end, boy, oh boy, I really hope it's okay. I really hope that come March 31st, 2025, everyone circle it on your calendar, because I expect a call on April 1st, someone check in on me and hope that it's all okay. I hope it's great. I'm just so privileged to have known you as long as I have, whether it was directly or just you marking my assignments. It really has been a gift to get to know you, and you're a tremendous woman. So thank you for everything that you've done. And everybody out there, thank you so much for joining us today. Really appreciate your attention and your willingness to come and meet Mary as I know her. And we will all see you again real soon. Thanks, everybody. Happy Lab Week, and keep well. Bye for now.